Hello and welcome to Healing Tips from the Heart, Intuition with Helpers, Healers, and Guides. I am your host, Dr. Lori Hops, licensed psychologist, writer, and artist. I've explored mind, body, and spirit related to intuition, or your personal guidance system, since early childhood. Meet my guests who have learned from their personal and professional lives to explore vast realms of knowing, synchronicities, and overcoming challenges. Their stories may inspire you with tools to enhance your daily living and relationships. Hello and welcome, my special guest and colleague, Dr. Kerri Husman, who is a medical doctor with many certifications. One of the most interesting that we're going to talk about today is a certification as psychedelic-assisted psychotherapist. We're going to be talking a little bit about her work using ketamine as a healing modality in her psychotherapy practice. She's also DCEP, Diplomate in Comprehensive Energy Psychology from ACEP, which I also share that same certification. That's how I know her, through the Association for Comprehensive Energy Psychology, where we both serve as board members. And amongst her many skills and talents and outreach into the community, Dr. Kerri is licensed as a psychiatrist in Iowa, and also she has a separate performance and wellness coaching practice where she does shamanic work and help with wellness and performance. And I welcome her so much. So good to see you. Is there anything that you'd like to add about your background or your training or anything else that you want the audience to know?
Well, thank you so much for that introduction, Lori. One thing to add is I'm a farm kid. So I grew up on a dairy farm in Iowa. So, hard working is in my bones. And I now have a biodynamic farm myself that I live on and work. And we do primarily orchard work now. We've raised livestock in the past, organic and biodynamic, done research in the past. But right now we are doing research on orchard plants. So.
I'm always mystified by how you have enough time in the day to do all the things that you do. When people look in the notes, they'll see like all the certifications and trainings that you have that you didn't just take, but studied and became proficient in. And there's hardly a thing I talk to you about that you don't know something about, not even in a superficial way, in a deep way. So, but yeah, I love that you are combining the natural world with animals and plants and plant medicine and consciousness and your heart and soul, which shines through all of it. And yeah, so maybe you could talk a little bit, for those who don't know, what is ketamine? Why do we care about it? How is it used? Why are you interested in it? And then we'll weave it into some talk about, heart-based and intuitive-based discussion. So I hope that's not too broad.
That's perfect, Lori. Thank
Okay.
you. So one of the nice things about ketamine, this top of the list is I have no other medication or treatment as a psychiatrist that can reduce or eliminate suicidal ideation in 20 minutes to 2 hours. I have nothing that can do that. I've never had a tool like that. And IV or IM ketamine can do that. And what we've found is, and it's the dosing, typically having a psychedelic dose, 0.5 to 1 or even higher milligrams per kilogram. That's the dose range when we're looking for a more psychedelic experience. Now, those experiences with ketamine aren't always magical, mystical, visual experiences. For some people, they are like, oh, I was, nurtured and loved and hugged on by Mother Mary or Jesus, or they feel like they were one with the universe and disconnected from all of the stressors of today's earthly life. And other people have just a very peaceful nap. They just rest. It's dark. Maybe they saw some fractals turning or spinning, but it's very just peaceful, restful. Some people have ego disillusion, which the first time you experience something like that can be a little bit unnerving or terrifying, but it's very
Well,
temporary, very transient.
yeah, sorry, let me just stop you there, because maybe people have never heard of that word, ego dissolution. So it's the dissolving of the ego.
Correct.
Yeah, so can you talk a little bit about that? Because that could sound very threatening.
So, whether or not you're someone who believes in the ego, superego, and id from way back in your teaching, if you're in the therapy world,
Mm,
um, our ego is a big part of how we get through our day.
mhm,
Part of that is entwined, if you wanted to look at it, with the default mode network. And the default mode network and our ego is what keeps us paying our bills and showing up to work every day and keeping a roof over our heads and all those things we feel responsible for. The
mhm,
unfortunate thing is that it's littered with negativity. If
mm,
I don't do this, I'm a blankety blank. If,
mhm,
how stupid were you to have done that yesterday? It can, and it gets littered with a lot of four-letter words. It's just really not kind.
mhm,
And when you have the experience of that dissolving, it is it's a quiet that sometimes only lasts for what feels like a split second. Sometimes it can be much longer. And again, it does depend on which expanded state method you're using to have that ego dissolution experience, because I have had that experience with other methods as well that are not requiring of medication. And when you experience that, it's like all the layers drifted away and you realize that none of these things that we've decided are so incredibly important really matter.
mm,
And when we have that experience, it's a part of a nice reset. One of the things that ketamine does is by resetting the default mode network and taking that offline for a bit, the right brain tends to be more dominant and we see things from other viewpoints and perspectives.
mhm,
And so when you think about, how a cat gets stuck in a bag, and even though they just walked in the bag and could easily turn around to walk out, a lot of times with treatment-resistant conditions, the things that we normally use ketamine for, so treatment-resistant depression has by far the most data, but it's also used in substance use disorders, um, eating disorders, and PTSD, and other anxiety disorders like OCD. Um, People can get very, very stuck.
mhm,
They've been through multiple medication trials, maybe been through pretty harsh integrations or integrative psychiatry treatments like ECT, and don't feel better.
mhm.
And this is one of those tools. I mean, ketamine is non-inferior to ECT at this point. Yet ketamine is not approved by the vast majority of insurance companies as a treatment
Yet.
yet.
And ECT, for those who don't know.
Is electroconvulsive therapy, so that's shock treatment, and
Mhm.
it still is one of the most effective ways to get someone out of a severe episode, but it comes with the cost of possible memory loss, which can be long term.
And what about problems with ketamine?
So, ketamine, from a problem standpoint, is pretty limited. Um, People who use ketamine recreationally, so high doses, possibly daily or long term, can develop severe bladder issues. There
Okay.
can also be some memory issues that can happen from misuse, overuse, and abuse.
Mhm,
The way ketamine is given from a treatment standpoint, typically 6, possibly even 8 or 10 sessions in a short term, such as 3 or 4 weeks, when someone having an initial course of ketamine. And then after that, they may require boosters. Not everyone does.
mhm,
Those boosters, theoretically, as someone is doing better and better, become less and less frequent. So maybe it's 2 weeks, 4 weeks, 6 weeks,
mhm,
12 weeks. And so needing less over time and building durability of the experience and the outcomes over time is the secret sauce. That's the part where the work is being done with integration techniques to try to help build durability. Now, one of the downsides or problems with ketamine is that durability question. So when people have a positive response to ketamine, Sometimes it lasts a couple days. Sometimes it lasts 6 weeks.
Mm.
And there's a frustration there that, oh, I felt so much better. And then they're coming backward. And that's why people do that set of the series of 6 or possibly 8 or 10 sessions right away early on to really get some durability built up.
Because you want to have a new foundational base to go to rather than back, like you said, the cat in the bag.
Right.
Yep. Feeling trapped.
And so one of the important things with the use of ketamine is set and setting. So the mindset of the individual, looking at this as with hope and not as the last thing on the list, right?
Okay.
There are always other treatments. This is not the be all end all. This is a tool in the toolbox. But also the setting, where you are administering the ketamine, really setting the stage for that to be a healing environment. And this is where energy psychology can certainly step in to help with both the mindset and the setting, as well as the integration afterward.
Okay. So the image that I have as you were talking was someone strapped to a table, like their limbs, everything. And all of a sudden, when the ketamine comes in, all of those bands open and they're free. So they're unencumbered. But then what?
Right.
Do you still lay there on the table? Do you still feel trapped? Are you in so much terror because of all the struggling that you've been doing to fight against the straps that you don't know how to do something different? You haven't had the chance to know peacefulness, relaxation, calm. Do you get up from the table? Do you fall off? So it's I see where set and setting are so important, and I imagine that they're important before you administer the ketamine.
Correct.
Yeah.
Yes. So there typically, if someone is going to start a series of ketamine, we've had multiple conversations, or if they've been referred to me, they've had multiple conversations with their therapist or their doctor who has sent them over about what this could be, and then having multiple conversations with me before we start.
Yeah. So that you're really prepped. So
Right.
how long do these sessions last?
So for treatment-resistant depression, typically the amount of time that the ketamine is active in the system, as far as the medicine either being infused with an IV or you've had an IM injection, is about 40 to 45 minutes up to 90 minutes.
Okay.
Yeah. So it's not a real long time,
Mm-hmm.
but there's some preparation prior to that. There's a little bit of integration immediately thereafter.
Mm-hmm.
It's like sands through the hourglass, right? You're trying to capture the things that you may have seen or felt or experienced or known very deeply during the time that the medicine was in your system. Now, granted, the rest of the day you can't drive, you shouldn't make any major decisions,
Mm-hmm.
you should not talk about stresses with money or finances or making life decisions. You should just ideally go home or comfortable place and rest and
Yeah.
do some more integration on your own, which might be some journaling or writing, or might just be really savoring quiet.
Yeah. Yeah. I can see where people might sleep.
Yes, a lot of people do sleep afterward. And the
It's
people who
almost
come
like
from
post-surgery.
Mhm.
It's like a post-surgery experience. Yeah.
Yeah, because it is a mild anesthetic, and so people will feel a little bit numb, meaning their body might feel a little tingly or numb like that. And even walking afterward, sometimes they can feel a little bit like a tin man.
Yeah.
And so you are taking some extra caution the rest of the day.
Yeah. And drinking water.
Drinking water and then kind of working your way back into your normal diet, because we usually have people NPO for a few hours beforehand. And so nothing by mouth, just sips of water if they need, because we want your stomach to be completely empty, just because nausea can be an issue during the medicine treatment.
Oh, okay. Interesting. Yeah. Interesting. So what have you seen in terms of effectiveness and outcomes and stuff?
Well, what's interesting is, even if I've seen some, I mean, we're using it for treatment resistant depression,
Mm-hmm.
and someone has an addiction history, even if they're in remission, maybe been in remission for years, many people who have addiction histories will still have cravings occasionally, thinking about using, and even if they are receiving, they're in AA or NA and have a sponsor, cravings tend to go down quite a
Mm,
bit. So
mm,
it's a wonderful bonus.
mhm,
Um, what happens with people who are on longer, so let's say they're going every 2 months or every 3 months in between sessions, what they'll notice, and some people, I mean, again, depends on the person. For some people, they're on still medications to help maintain mood because this is one extra tool, right? For other people, they aren't on other meds. This is all they're doing is the ketamine alone
mhm.
because they've had a variety of meds they've tried and they've not been able to tolerate anything due to being very sensitive to side effects. And what normally happens as they're getting close to needing a next booster, if that happens for them, is sometimes they start having suicidal thoughts creeping in, some negative, maybe not active, no intention or plan, but sort of passive thoughts of what is the point, and then that kind of gives them the little, okay, I think I maybe time for a booster.
Mhm.
Um, for some people, what happens in between is that they remember why they feel like there's a sense of purpose to their life again.
Yeah.
That's the thing that returns. That's the cat
Yep.
out of the bag. And and if that starts to slide or diminish or feeling sticky again, um, what's great is even though this maybe doesn't have the durability of of some of the other psychedelics that are not yet approved, um, it's giving people hope back and their life back,
Yeah.
even if they are having to have a periodic booster, which is still such a step above and beyond where they were before.
Beautiful. Thank you for sharing all of that. It's so interesting. This is a lot of people in our field are talking about this is the wave of the future for mental health care, amongst other things. It certainly goes hand in hand with what we're trying to do with energy practices
Hmm.
is connect people to their inner truth rather than the programming that they've been given that is usually given with wisdom and care from another time. This worked for me, or this is how I was trained, and so this is what I was taught, so this is what I'm giving you. But it may not be useful any longer because the situation's changed, the generations have changed, every person is different, and wisdom changes. And so it's almost like I saw in that vision of opening the shackles, but then you have to move towards something new. And there's that unknown, that scariness of what is that and how do we even get there? So I can see where our energy practices and other psychotherapy is a beautiful bridge. Once the shackles are off, then what do you train towards?
So that's a really good point, Lori. And one of the things that's so important about working with people who are using psychedelics in in a practice for a purpose of improving a mental health state is to be trained in integration.
Mm-hmm.
While many of us who are utilizing mind body techniques may feel like, well, I have all this mind body or that mind body or 5 other mind body techniques. Why would I need to have additional training and integration? Um, the main reason is that the vast majority of the techniques that we're trained in as therapists, as coaches, as healers are directive. Whether we want them to be or not, whether we think we are or not, we are directing someone. Here's a new technique I'm teaching you. Here's
Mm-hmm.
something that's going to help XYZ for your self care. And we are constantly kind of pushing the narrative because we want people to get better. And here, look at this new thing I learned. I want to share this with my patients. And that's unfortunately directive. And integration is so much less that and helping restore the power of your client, restore their personal power, their inner healing intelligence, that inner guidance system back online so that they can be making their decisions in their power, standing in their power. So, how integration is delivered is really bringing the question back to the client when they said, well, Mother Mary was there, and she hugged me and she sent me a message. What does that mean for you?
Mm-hmm.
It's not about interpreting that
Mm-hmm.
message or interpreting that experience, but really helping that patient find meaning in
Mm-hmm.
all of their life experiences, including those that were suffering.
Beautiful. And that is a different, it's more psychodynamic. Holding space, or call
Hmm.
Rogerian,
Yep.
unconditional positive regard, or existential,
Hmm.
these things that are not as empirically based. They're not step by step manualized.
Hmm.
It's more of a holding space for someone's unfolding. And so,
Absolutely.
yes, there are steps that you need to understand and how to navigate that, definitely. But it's it's setting the space and the environment so that the opportunities can arise.
Absolutely.
Yeah. And if you're thinking in terms of yin and yang, it's a yin process.
Absolutely.
Yeah.
And what's been great in the trainings that I've done is, people are coming from all sorts of backgrounds. And when they're having this additional integration training, and there's some great manuals out there to expose yourself to integration methods, great articles for integration, to understand how you could weave in your trainings and experience into this very self-empowering for the client method. So there's a litany of things to learn from. You can you're not going to get bored.
Well,
Never
that's
get
the
bored.
yang, that's the
Yeah.
structure.
Hmm.
And people do need structure and guidance until it becomes more intuitive, and you can kind of make it your own. But the structure doesn't come from, and now you do this and now you do that.
Right.
With the person, it's more, I create this environment and now you're solid and you're safe. And so now you can go, the client can go and explore and
Hmm.
learn and self-discover. It's incredibly empowering. I mean, depression, you talked about addiction and stuff, but a depression, first off, is a soul death. It is losing touch with the vitality of life for different reasons. And when it stays long enough, it becomes the worldview and the truth and the only way. And so this is like opening that door to another reality. And then there can be a bewilderment, or even just a lack of practice about how to even navigate a new reality, which is your true vital reality you're born with, that you're coming back to. It can be shocking. And so I like that there's a gentleness of self-discovery, so that you're not pushing the agenda, the timeline, the awareness. You're letting it kind of unfold in a more organic way.
Yeah. As you were speaking, I was thinking of an example from a client that after her ketamine experience, she was sharing, having a share with what she had experienced during the medicine session. And one of the things that she shared was, I realized that there's this, I mean, it was just, I think I did actually laugh. There was a laugh with, not a laugh, about. But she said, it's like now I'm aware of this fist-sized ball of glowing light in my lower abdomen. What is that? And I'm like, well, would you like to know? And would you like to learn to work with it? I mean, and she was, oh yes, absolutely. It's not every day that something, from the energy world is gifted to you like that, right? And so we did, I said, well, if you'd like to learn to walk through that, we'll just do a little lower Dantian expansion
Yeah.
exercise. And she, like, was like an extra layer of mind blown for that day, right? She
Yeah,
was just
yeah, yeah,
so
yeah.
big-eyed. I could feel it. Yep.
Yeah, that's exciting, and
Hmm.
it's cool, and you need time to adjust. It can be shocking. I mentioned the depression, but the thing that I've heard so much about, one perspective about addiction is looking for that connection to spirituality, to God, to something beyond the 3D, physical here and now experience. And that sometimes substances are can be a bridge to that longing for a connection with something else, or just that feeling loved. And so this is a different way to bridge with something that isn't, you don't need to keep taking the substance
Right.
to chase the high or to find the soothing or to escape the pain or whatever the core motivation is. Yeah.
Yeah, and that durability, with psilocybin and MDMA, while there's neuroplasticity and neurogenesis after a ketamine experience that goes on for about a week, there's about a month with psilocybin and MDMA, and that longer lasting experience with it has pros and cons. So when you're more open after an experience, you are also more open to trauma. So a traumatic experience, in the days following a medicine experience is going to require potentially more help than it would have otherwise. So
Because
I've
you're
had
more
that.
raw, you're more exposed, more vulnerable. Yeah.
And so, but that's why having a practitioner who is aware of these things and the patient being or client being open to sharing with you, hey, this happened, I was just in a car accident, whatever it may be, and we do some work, as soon as we can after that.
Is there a greater likelihood of having post-traumatic memory surface as a result of the ketamine experience?
So what I do teach patients is prior to each ketamine experience, I typically teach them some technique or tool. And so there are many energy psychology methods that can be utilized in the moment if something comes up during the ketamine experience. Obviously, they can just call me over also, right? But I like to empower people with techniques that they can use right there in the moment independently if they need, if they don't want to share the details or don't feel that they can. Sometimes it's unique like that where it's harder to speak.
Yeah.
And during the medicine session, your coordination's a little bit off, your speech can be a little bit off. And so having something that you can do in the moment that you can utilize is really valuable. So we remind, reteach, and so people have this little list of things that they can access whenever they need to.
Do you do tapping? Do you do breath work?
I certainly do all those things, yes. As far as tapping in a ketamine experience, certainly could be done, maybe hard to do. You've got a monitor on one finger for pulse ox constantly, and you've got, and again, that coordination issue,
Yeah.
it can just, it's a little hard to do, not
Sure.
impossible.
Yeah.
But touch and breathe is certainly possible.
Yeah. Got it.
Yeah.
Very good. And I'm sure imagery work, if you can focus enough.
Yeah, because some of the imagery is coming up already. That's
or affirmations, prayers, that kind of thing. Yeah, interesting, very interesting.
Yeah.
So do you find that people's intuitive abilities are enhanced after ketamine experiences?
I have certainly had patients say that that they have felt afterward, in the days afterward, that their inner guidance seemed to be online, that they just had a deeper connection, deeper awareness, and felt that they just kind of knew what to do. And again, this is why we still tell people, major life decisions is not the time to move across country, have a divorce, change your job, take some time to reflect here first.
Yeah.
but there is a clarity people
Interesting.
feel.
Yeah, very, very interesting. Oh, you've shared so many tools and ideas, and I think that people are going to be hearing more and more about it. So thank you for opening the door for some people, and people might want to try to, they know of themselves or others who want to try this. And so do you have suggestions about where people can look along with yourself? But you're only in one state and you're only one person.
I am. So with me, if people are out of state who are planning to do a ketamine series, um, I work in a high rise. So I'm on the second floor of a high rise hotel right directly above me. And so people can come and stay if they need to,
Mhm.
if they're out of state. And there is a network. There are a couple different networks, the Psychedelic Medicine Association. There is the Association for Ketamine Practitioners, ASKP3. So there are ways to utilize finding a ketamine provider. There are certainly ketamine infusion centers out there that are typically um, not staffed by a psychiatrist. There's typically nurse practitioner, nurse anesthetists oftentimes run those. And with good intention. I mean, they are providing extended infusions for pain, for example, like 4-hour infusions, and infusions for a variety of psychiatric conditions. I use IM in the office because IVs take a lot of extra work, and a lot of people don't like them. And when ketamine goes in, as far as an IM injection, there's a little bit of a burn when it very first goes in. I mean, we're talking seconds here because it has a numbing experience immediately thereafter. So
Okay.
you don't, I mean, it's pretty easy versus an IV and having to navigate that. And a lot of people just really don't like having IVs. So,
And for those who don't know, IV, intravenous, and
and
IM,
IM is
intramuscular.
intramuscular in the
Yeah,
deltoid typically. Yep.
the shot.
Yep. Super easy.
Yeah, very good. Okay, well, that's wonderful. So we're coming to the end of our time. Is there anything else you wanted to share about helpers, healers, and guides, or intuition from the heart, or anything else that we haven't talked about?
Um, if people are looking for a good training program, feel free to reach out to me. Um, I've trained with IPI. I have colleagues that have trained with other organizations who've also had very good experiences, feel very well trained as far as um, really understanding, creating set and setting, and providing that integration support. And so, but finding people to network with who are doing this work, really important.
Yeah, you're at the forefront of the next wave.
And hopefully that wave
Fabulous.
keeps moving in a good direction.
Yes. Thank you so much for sharing all this and a fascinating topic. And I've certainly learned a lot just from this brief introduction with you.
Thank you so much for having me, Lori. I appreciate it. Have a great one.
Okay, you too. Bye-bye, everyone.
Bye.
Thank you for joining us for today's podcast. If you want to learn more, you can visit my website for podcast and resources at hopshealingtips.com. You can also like, share, and subscribe to this channel. This podcast is for information and entertainment purposes only and is not providing healthcare advice. Please seek guidance from your professional healthcare team should you need assistance.